my name is Eve. I'm a nurse practitioner student, and I will be doing an exam on you today. Is that okay with you?
Yes.
Good, okay. My hands are washed and cleaned. I'm first going to be starting the exam by inspecting your head and palpating your skull. Head is normal cephalic, symmetry and contour are normal. Now I'm going to be inspecting your scalp. No masses or lesions noted on the scalp. Hair is evenly distributed. Texture is normal. No signs of hair loss or abnormalities in the hair. Now I'm going to be inspecting your face. Face is symmetrical, no droopiness. Skin is intact, no lesions, masses, or scars noted on the face. Now I'm going to be palpating your temporal arteries. Okay. Pulses +2 equal bilaterally. Any tenderness when I was touching? Good. No tenderness noted. Now I'm going to be moving on. Looking at your back to your face. Hair distribution on the face is normal. For your gender and your eyes, eyelashes, and eyebrows, hair distribution is normal. Looking at your eyes, they are symmetrical on your face. Looking at your eyelids are normal, no abnormalities or redness noted on the eyelids. Now I'm going to be palpating temporal, lateral, medial, and lateral canthus are intact. Lacrimal system is intact. There's no drainage, redness, or swelling noted around the eye. Now I'm going to be looking at having you look down for me. Good. Have it look up for me. Good. Okay. Conjunctiva are pink, moist, and intact. Sclera is white. White. No jaundice or hemorrhaging noted. Iris are round and equal and normal in color. Pupils are round, equal, and 3 mm each. Cornea and lens are clear with no opacities. Okay, now I'm going to be testing your light reflex. So with first I'm doing direct light reflex. With my light, I'm going to be looking into your left eye and checking that your left eye pupil constricts when the light hits it. Good. Same thing with the other side. Good. Okay. Now I'm going to be moving on to consensual light reflex. So I'm going to be hitting the light into your left eye and observing your right eye. Pupils constrict. Same thing on the other side. Good. Okay. Normal findings. Now I'm going to be testing for convergence and accommodation. I'm going to have you follow my finger with your eyes, please. Okay, eyes converge symmetrically. Now I'm going to test for accommodation. Look at the wall for me, at the picture on the wall. Now look at my finger. Okay, pupils constrict when looking at a clear object. Now I'm going to be testing your vision. Okay. All right. Do you wear any glasses? Okay. Or contacts? Okay. Cover your right eye and read the last line.
LTFPH.
Good. Other side. And read it backwards.
HPFTL.
Good. Okay. Vision, visual acuity is 20/20 uncorrected. Now I'm going to be testing your peripheral vision. If you can cover your right eye and tell me when you see both hands.
No. No. No.
Same thing on the other side.
No. No. No.
Okay. Now I'm going to be doing your extraocular movements. Follow my finger, please, with your eyes. Extraocular movements are normal. No nystagmus noted. Now I'm going to be doing your endoscopic exam. I'm going to be looking at taking my right eye and observing your right eye. Red light reflex is present. Optic disc is sharp. Cup disc ratio is 2:1. No AV nicking noted. Retinal vessels are intact. No signs of hemorrhaging. Cornea and lens are clear with no opacities. Macular is yellow and milky white in color. Now I'm going to be doing the same thing on the other side. Left eye, good, normal findings. Now, I'm going to be looking at your, moving on to your nose. Inspecting your nose is symmetrical. Won't be palpating. Any tenderness noted?
No.
Okay. Now I'm palpating your maxillary and frontal sinuses. Any tenderness there? No. Okay, good. Now I'm no masses or lesions or redness or swelling noted on the nose. Now I'm going to be looking inside of your nose. Okay. Okay. Septum is midline. No polyps or protrusions noted. No excess drainage noted. Now we'll be doing the same thing. Hold it back for me. Same thing on the other side. Okay. Good. Normal findings. Now I'm going to be testing your patency of your nose. Please cover one nostril for me and breathe in. Same thing on the other side. Okay, patency is intact on the nose. Now I'm going to be testing your sense of smell. Please close your eyes and you're gonna smell for me. Tell me what you smell.
Cinnamon.
Other side.
Garlic.
Okay, perfect. Sense of smell is intact. Now I'm going to be moving on to your mouth. Your lips are pink, moist, and intact. No lesions noted. Please show me your teeth and your gums. Good. Okay. Gums are pink, moist, no bleeding. Teeth are normal, no missing teeth, and no abnormalities. Let me see your buccal mucosa. Please open up your mouth. Okay, buccal mucosa is pink, moist, intact with no lesions. Okay, tongue is normal in color and size, no swelling. Range of motion of the tongue is normal. Under the tongue, the frenum is midline and intact. Good. Okay. Let me see. Okay. Hard and soft palate are pink. Soft palate is soft. Hard palate is firm. Now I want to check your tonsils. Say Okay. Tonsils are equal. +1 equal bilaterally. No exudate or swelling noted on the mouth. Okay. Now I'm going to be moving on to your ear. We'll be palpating and inspecting your ear. No masses, lesions, or tenderness. Any tenderness noted? Okay, no. Now we'll be palpating your tragus, your mastoid process. Any tenderness?
No.
Good. Okay. Now I'm going to be inspecting inside of your ear. Pulling your orbital up and back. Cone of light seen at 7 o'clock on the left ear. External canal is intact, no redness or excess serum noted. Tympanic membrane is pearly gray in color. Malice is observed. Now I'm going to be doing the same thing on the other ear, pulling your ear up and back. Okay, no abnormal findings. Cone of light is seen at 4 o'clock on the right ear. Now I'm going to be testing your hearing. Starting off with the Weber test, I'm going to be striking the tuning fork and placing on your on your midline. Please tell me if when you stop hearing. Please tell me. I'm sorry. Please tell me if sounds are equal on both sides.
Yes.
Good. Okay. No lateralization noted. The normal findings. Now I'm going to striking the tuning fork again, placing it behind your mastoid process. Tell me when you stop hearing.
No.
Do you hear?
Yes.
Yes. Okay. Good. Same thing on the other side. Behind your mastoid process.
No. Yes.
Okay, good. Air conduction is greater than dome conduction. These are normal findings. Now I'm going to be coming behind you and doing a whisper test. So you're going to cover your right ear, and you're going to repeat what I say.
1, 2, 3.
Good.
4, 5, 6.
Okay, good. Now moving on, I'm going to be checking your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, segmental, superficial, cervical, posterior cervical, deep cervical, supraclavicular. Any tenderness noted?
No.
Good. Okay. Now looking at your neck, appears to be normal. No masses or lesions felt on palpation. Trachea is felt in midline. Now I'm going to be testing your checking your thyroid. Please swallow. I'm going to be coming from behind you and palpating as you swallow. Okay. No goiter or enlargement noted when swallowing. Now I'm going to be moving on to your chest. Okay. Patient is draped for modesty. If you could please drape. Okay. Good. AP to lateral diameter is normal, 1 to 2. Chest rising symmetrically and equally. Rhythm is normal. Chest expansion is normal. Now I'm going to be inspecting and palpating. No massive lesions or abnormalities noted. Now I'm going to be percussing on all fields. Okay, resonance heard throughout. These are normal findings. Now I'm going to be auscultating. Take a deep breath in when you feel my stethoscope. Good. Okay, normal findings. Now, going on to the back, I'm going to be inspecting and palpating your back. Okay, no abnormalities, lesions, or abnormalities noted. Take a deep breath for me. Okay. Chest expansion is normal. Now I'm going to be percussing. Okay, resonance heard throughout. Close for me. Turn. Resonance heard throughout. Normal findings. Now I'm going to be auscultating. Take deep breaths, please. You feel my stethoscope? No adventitious response noted. Lungs are clear. Now I'm going to be performing an egophony test. You're going to say E for me when you feel my stethoscope.
E.
Okay, sound is soft and muffled, these are normal findings. Now I'm going to be doing the whisper pectoraloquy. I'm going to be, please, would you want to stethoscope? Please whisper, 1, 2, 3. Okay, sounds heard are soft and muffled, these are normal findings. Now I'm going to be doing the diaphragmatic excursion exam. I'm going to be percussing. Take a deep breath in, hold it. Don't listen to it. Now I'm going to be, take a deep breath out and hold it. Hold the breath out. Okay? Dullness noted, difference is 4 centimeters, these are normal findings. Now I'm going to be testing for tactile formitis. Turn please. When you feel my hand on your back, please say 99.
99, 99, 99, 99, 99.
Okay, vibrations heard throughout, these are normal findings. This concludes our exam. Thank you very much for your time today.